Welcome to Project First Line, a program developed by the Centers for Disease Control and Prevention. Over the next 20 minutes, we're going to focus on two important pieces of your personal protective equipment, or PPE, gloves and gowns. Today, we'll talk about the role of gloves in infection control, and we'll also cover some do's and don'ts for using them in work every day. So we're going to first go over the objectives, the learning objectives, and then we're going to discuss the role of gloves in infection control and some of the do's and don'ts for using gloves at work, and then next steps, and then we will move on to talking about gowns. So our learning objectives are to describe two reasons why wearing gloves is important for infection control, and discuss two reasons why wearing more than one pair of gloves at once is not recommended for routine care. There are going to be times with some very specific diseases, but for the most part, one pair of gloves is recommended. Gloves protect you and keep germs from spreading. They keep you from accidentally spreading germs into your work environment, and they help stop germs from spreading from place to place while carried on your hands. So how do they do that? Gloves cover any breaks and cracks in your skin so that the germs can't get to them, and they keep germs from spreading from your broken skin to others or the environment. If you touch something with germs on it, the germs can get on your gloves. And then when you change your gloves and perform hand hygiene, you prevent the germs from spreading around. Gloves must be worn properly to be effective. And how do you do that? You need to make sure that you clean your hands before and after you use gloves. So after you've taken your gloves off and before you put on a new pair, and before you reach into the glove box to pull out new gloves. Don't wear two pair of gloves at once. It can make your fingers harder to move, and you can inadvertently spread germs when removing and replacing the top layer of gloves. So what questions would you still have? You've used gloves probably since your very first day. Key takeaways to this: it's an important strategies for infection control, both to protect you, the healthcare worker, and to protect your residents and patients. They protect you and keep you from accidentally spreading germs to your environment, but they must be worn properly to be effective, and wearing two pairs of gloves at once is not recommended for routine care. So now we're going to talk about gowns. We're going to talk about the role of gowns in infection control and some of the do's and don'ts for gowns at work. So the learning objectives are to describe two reasons why wearing gowns is important for infection control, and discuss three reasons why wearing more than one gown at once is not recommended for routine care. So gowns protect you from germs and your clothing and your skin, and gowns protect others by keeping germs out of the environment. Gowns make it easier to remove things such as germs and body fluids that might get on you, on your clothes while you work, so you don't have to change clothes every time your clothes get dirty. When you remove and dispose of your gown properly, you keep those germs from spreading in the environment. To remove your gown, you remove it when it gets dirty and before moving between residents or patients or tasks. You want to make sure that your gown fits properly and that it doesn't touch other surfaces while you're wearing it. Gowns are designed for use as personal protective equipment, and they're intended to be worn as a single gown. Wearing gowns is an important strategy for infection control. Protects you and keeps you from accidentally spreading germs into your environment. Gowns must be worn properly to be effective, and wearing more than one gown at once is not recommended for routine care and can be an infection control risk. If you have any questions, you can contact cdc.gov and they can get answers to you. Thank you very much.